So yes, today I'll be talking about this new model, Accept, Connect, Embody, and this is the model that we're using at Imperial in our psilocybin for depression study. So this is our lovely team, and I wanted to start by thinking about this question of why we need a model. So we know now, we have data, that context, the ways these experiences are framed and contained, is crucial for therapeutic outcomes. And a framework helps us structure and retain the essence of something which can otherwise be very slippery and very large. So when you go into the deep sea of psychedelic experience, you can think about the framework as a kind of fishing net. It's not going to dictate your experience, you hold it lightly, but it might help you retain something that you can then take home and treasure. Also, this model, I think, is part of a larger movement, as Charles just said, into a different paradigm of mental health care. So we need to be talking about resilience, indeed, and going into pain and through it and learning from it, rather than suppressing that pain. That's very clear to me now. So this is not to neglect that there have been and will be many other models for psychedelic therapy, but what we're trying to do in our team is really ground our own experience within a scientific trial, using data and the experiences of the patients and our experiences to really test ways to contain psychedelic experiences. So this model has emerged from the clinical work, and it's a kind of living organism, and we're constantly validating it all the way with the results we're seeing. So this is our clinical room in London. We are seeing in the current study 60 participants with major depression, and we're comparing psilocybin with escitalopram and SSRI antidepressant medication. Everyone in the study has 2 psilocybin sessions. They're 3 weeks apart, and they can be either high or low dose psilocybin. And everyone also receives 6 weeks of tablets, and they will be either placebo or escitalopram. And we're using the standard PrEP session integration model for the therapy, psychological support. I'm not going to go into detail here because of time, but essentially the PrEP session is a kind of afternoon together. We eat lunch together. We talk a lot about, we focus on nurturing trust together. It's very human to human. And in the sessions themselves, they're framed as music meditations. So we encourage people to focus on whatever their experience is, rather than trying to work out if it's a high or a low dose, and just be with what comes up. And they have 2 therapists with them the whole way through. And then the integration is 3 face-to-face visits and 3 Skype sessions. We've standardized this approach now, the Accept, Connect, Embody model, which I'll explain here. So the starting point for the model was the first psilocybin for depression study, and that was, I had experience in that study of guiding participants, but also of doing qualitative follow-up work, where I interviewed all the participants. There were 20 participants. I interviewed all of them 6 months after their sessions to ask them what had changed, if anything, and how. And these 2 very strong themes came up. The 2 themes were that people described going from disconnection to connection, and they described going from avoidance of emotion to acceptance of emotion. I'm going to be referring to these themes quite a lot the whole way through, so don't worry about looking at them too much now. I'll refer to the relevant chunks when we get to them. So these 2 themes of acceptance and connection. A model was starting to form in my mind of the idea that acceptance and connection are in some ways 2 sides of the same coin. There it's kind of like the up, the down, the light, the shadow, the pleasure, the pain, the value, the suffering, and that you can't have one without the other. So the pillars of the model have been this qualitative research, the psychedelic integration group, which I co-facilitate in London, training in ACT, acceptance and commitment therapy. Our supervisor is a Groff transpersonal holotropic breathwork trainer, and that's introduced us to somatic experience and working with the body. And then lastly, experience of guiding, and for that we had Bill Richards train us all and work with us. So that's our foundation. And you can see at the top there that the ACE model is starting to grow. So from that pink and blue Accept, Connect circle, it's starting to get some new elements, which I'll talk you through. So we see the model as a kind of map for a journey. And we start with the C, the bottom half. And this is the process of going from avoidance to acceptance. And it's likened to diving down from thinking, which is the waves, into deeper feelings. So the surface waves, that's coping, it's the constant chitter-chatter of the day-to-day mind. It can be relatively benign. It might just be your to-do list and concerns and judgments, but it can be torturous, negative rumination, waves that you're constantly swimming against just to stay afloat. And that's what it's like for our patients when they describe their depression. It's like being trapped in those waves, not being able to engage with much around them, just constantly trying to stay afloat with the crashing ruminations that afflict them daily. And you see at the bottom there are some seashells. So those are the things that have happened to people in their past. It's the abuse, the loss, the terror, the chaos, things that have hurt people in childhood. And so you can imagine those things as the oysters on the seabed. And those shells might look quite pretty there in the diagram, but actually, as you see, oyster shells are quite gnarly and ugly and spiky. And inside them is slimy gunk. And that is the vulnerability, the trauma, the shame, the guilt, the things that we do not want to touch, and we do not want anybody to see. And so we keep that vulnerability and shame locked away in a very spiky, closed shell. And often we all spend lifetimes keeping those shells shut so that we don't have to engage with that vulnerable, slimy place. But underneath the hard, impenetrable shell, and underneath those layers of vulnerable shame and slime, there is sometimes a pearl. The way the pearl forms in an oyster is that a little bit of grit gets inside, and rather than the oyster shell pushing it out and saying no to it, it allows it in, accepts it, and it coats it over time with layers and layers of mother of pearl. So what was painful, what was gritty, gets turned into something precious. And it includes it. It uses it as a trigger for transformation, and this is how we grow. We transcend and include. And these shells accumulate at the seabed over life. So there'll be one key theme, some abandonment in childhood perhaps, and that's a big first shell, and then more and more shells of the same theme would develop over life. So abandonment's done to us, done to others, and the pattern keeps playing out. And it's very difficult to face that pile of oysters as it gets bigger and bigger, it gets more ominous. And also, we're stuck at this day-to-day level, we're swimming against those waves. We're dealing with the ruminations, we're dealing with day-to-day life. So we're swimming on the surface and we try and avoid that pull down to the trauma. And in our society, we have really been taught and encouraged and reinforced to keep swimming on the surface. And that process is called experiential avoidance. So experiential avoidance was first defined by Steve Hayes, who's the founder of acceptance and commitment therapy. But I like the definition here. The tendency to rigidly escape or avoid private psychological experiences, one of the most prominent diagnostic psychological processes with a known role in a wide variety of psychological disorders. So thinking about what that might look like. So rumination, for example, it's the mind going round and round trying to solve problems, trying to think its way out of horrible feelings. Thought suppression is trying not to think about things, distracting yourself. Emotional distancing, becoming numb, being cut off from the dark things that lurk below. And we all do it. But if you've got lots of trauma in your past, if your oyster pile is very big, then efforts to avoid those feelings can become more and more torturous. And it feels like there's this constant pull down, which makes swimming at the surface harder and harder as the waves get bigger. So research from the ACT world shows that actually, yes, individuals using experiential avoidance are found to be more prone to develop a variety of different mental health problems. Some of the research is shown there. And in my own qualitative study, indeed, with our participants in the previous study, we're going back to the theme of avoidance of emotion, that it was quite common for them to report, and this is, I didn't ask them, do you avoid your emotions? This was spontaneously in their own accounts of their experience of depression. They would talk about how they would avoid emotion, they would be numb and unable to feel emotions, and they would attempt to push them away. And that actually being stuck in their heads was a way, indirectly, of shutting down the emotional repertoire, even though it wasn't something that they wanted to do, it was happening. So in psychedelic work, we would call experiential avoidance resistance. So Jung said, what you resist persists, and indeed resistance is where most of the suffering in a psychedelic journey lies. If you avoid or run away from something painful, it gets bigger and bigger and scarier and scarier. And people describe really being able to feel the pull down to direct experiencing of emotion and the mind not wanting to let go. So they feel themselves on that surface with the mind in control and that feeling of like falling down into something painful and strong and embodied. But actually the resistance to that is much worse than going into those feelings themselves. So people that have come to our study have been avoiding and resisting their emotional pain, whether they wanted to or not, or whether it was partly because they were prescribed antidepressants in many cases that made it more difficult for them to engage with emotions, and they left them feeling quite numb. They'd been cut off from their pain for many years. And indeed, our culture really reinforces this. It provides many ways to keep a lid on our feelings, and very few ways as a society to engage with our pain. So people came to us really ready because the medications hadn't worked, the therapy hadn't worked. Many of them had tried so many, like 13 or 14 types of antidepressants and many different types of talking therapy. They were so ready to try something else. They were ready for this new paradigm. And indeed, the qualitative research showed that psilocybin can be a quite radical introduction to acceptance without really much efforting. It kind of, for many people, happens. So people described in the qualitative study that during the psilocybin experience and afterwards as well, there was a sense of acceptance, surrender to emotion, being able to access memories they couldn't before, an embodiment of emotion, and that emotional repertoire was expanded long term. So I've got a clinical case example here, and this is from somebody who wanted me to use his real name. He's called Mark, and he had his first session 3 weeks ago and his second session on Tuesday. And he sent me his journal last night, and I wanted to read something from it because it's beautifully written. So he suffered horrific sexual abuse in his childhood. He then went on to become a paramedic and a successful DJ. He is a very, very empathic, sensitive, and creative person with huge potential, but depression had trapped him, caught him. He hasn't been working for many years, and he's been really stuck at home, living a life that is desperately difficult for him to continue leading. So his first session, this was the one 3 weeks ago, and this was the accept experience. So this is from his journal. Trust, let go, be open. This is a mantra from Bill Richards, by the way. Trust, let go, be open. I keep repeating this mantra, and it really helps as changes occur in the landscape of the music, particularly as the music becomes more dark. Feelings related to the past sexual abuse come up. They appear like a black bubble, like crude oil in zero gravity. And although they are unpleasant, they are just feelings. They're not overwhelming. I stay with them while they're present. I feel intensely frightened, which leads me to instinctively want to call out for my mother. I say mother rather than my mum because it's desperate longing to reach out to my mother figure, because at this moment of longing, I realize that I do not have a mother figure to call for. The suffering and inner anguish that remains inside is so deeply ingrained. It is now accepted as part of me. I am it, and it is me, inexplicably linked. And whether or not I wish it was there, I embody it totally and make it my greatest ally. This is the new foundation upon which new growth will come. My new growth is like the house built in an earthquake zone that is designed to withstand the huge shock waves that can happen from time to time. So, is there evidence for this avoidance to acceptance process as a mechanism of change in psychedelic therapy? Well, the qualitative research is a good initial guide, but we'll need more experimental research to follow it up. We will be using a measure of experiential avoidance in our current study, but that data won't be here for a while. In the meantime, we have 2 really great papers coming out soon, and they're looking at the data from the psychedelic survey, and they're correlating reduction of experiential avoidance during and after a psychedelic ceremony, and they're correlating it with a reduction in depression scores. And both of those papers find or suggest that, yes, this might be a transdiagnostic mechanism underlying the therapeutic action of psychedelic therapy. So that's the first theme, avoidance to acceptance. And now we're looking at the disconnection to connection theme. So this is the top half. This is the sunrise over the water. So going back to the qualitative data, looking at the pink section here. So if you're stuck in disconnection, if you're stuck in rumination, negative thought patterns, you're constantly swimming against these waves, and it can be very hard to see where you want to go in life. You're treading water and you're trapped. So this reminds me very much of a participant from the first study who was in a film called Magic Medicine. He's called John. He's a farmer, and in the film, it shows him standing in really beautiful green woodland scenery, which is just near his farm. And he says to the camera, "I would rather be in a locked room, a locked dark room with no windows and doors, than in this beautiful place, because I can't connect to this. And just being here and knowing that I'm supposed to find it beautiful makes me feel worse." So after psilocybin, I mean, he had been in his bedroom for a decade. His wife had been running the farm, and he had been inside for about 10 years. His children were in their teens, and they couldn't really remember what it was like when their dad was around. And then he had a psilocybin experience, and it helped him come out of his room, and he connected with his farm and his family and the land around him. He appreciated it all. He felt part of it all. And this is quite common. We see after the psilocybin experience, people that have been very disconnected feel this state of connectedness for a while. It's not permanent. It's for weeks or months from what we can see so far. And it's very, very sad for people when it goes away, because they have no way of accessing psilocybin again. And so then they're stuck with having tasted the green trees and then being back in the room again. And it's a very bad situation. But psilocybin can bring about the state of connectedness, which is still really valuable, even though it doesn't last forever. And we can look into ways of expanding that window in future studies, future work. The connectedness is a wonderful thing. So Max Wolf asked me yesterday to define connectedness, because it's not a concept that's really been taught in standard psychology. It wasn't part of my training. There was no connectedness chapter. So what is connectedness? Because in the psychedelic world, we talk about it quite a lot, but we are going to have to start defining it. And I can no way get close to a proper definition here, but I was thinking about it last night of what is it? And I think that connectedness is what happens after openness begins. So first we open, and then we connect. So disconnection is being trapped in the dark room. And then the door is opened, and then your 5 senses can see and taste and feel and know yourself, to connect to yourself as part of everything that surrounds you. So to use our analogy of the water and the sun, connection is coming up from the dark waters, seeing the horizon, seeing the bigger picture, feeling it, tasting it, touching it, knowing it, being it. So back to Mark, so his second session, which was on Tuesday, and this was his connection experience. It doesn't always work like that. You have an acceptance one and a connection one, but for him it was a bit more like that. Last time I felt I had much baggage with me. I was literally dragging around lots of memories and traumas through the psychedelic experience that my mind has latched onto tightly since birth. Experiences that I felt defined me and reinforced the view I had of myself. The baggage appeared as symbols of life events, and their attachment felt like that of a child with their comforter and with a reluctance to be apart from it for any length of time. Being free of this baggage now, I feel liberated and no longer afraid. Then he describes in the experience how he was met by a group of spirit guides. The spirit guides welcome my intentions of peace, serenity, and enlightenment, which are seen to be noble to them. They share wisdom, give guidance on what I should do in life, and reassurance that I am embodying great virtues that will lead to the accomplishment of great things. They feel it is important for me to share my values with the world. More people need these qualities. I find myself right at home here. I feel my true self. I visualize myself as a tree, growing stronger by incorporating all that surrounds me. And at this point in the session, he said he could actually feel himself growing. He was growing moment to moment and could feel it in his body. So I'm growing out like this, and it means I can thrive by adapting to the environment and living harmoniously amongst it. I feel deep-rooted and connected to all life on Earth. Life in the astral plane here is awesome, in the truest sense of the word. However, the physical interconnectedness of life on Earth is sheer beauty and the most joyous of things to be a part of. The suffering that is part and parcel of the mortal experience is perhaps the most beautiful part. I struggle to really comprehend this wisdom, but I feel it. So again, thinking about evidence for the disconnection to connection mechanism, we don't really have so much yet. There wasn't a measure of connectedness. We've developed one at Imperial, so we're hoping lots of studies will use it and we'll start to be able to look at that data. We're using it in the psychedelic survey. And also there's going to be a really amazing study by a colleague, Leo Roseman, looking at, it's a reconciliation study, which is going to be looking a lot about this concept of connection, so watch this space. So I hope that's given you an overview of how acceptance and connection have crystallized and become a fundamental part of our work. I haven't really talked about embodiment. That would be a whole talk in itself, but I guess it runs the whole way through it. So it's basically embodiment is the means through which acceptance and connection happen. It tends to be a whole body process of experiencing and feeling and sensing and holding. So I will now talk through briefly how we use the ACE model in the study, so how it works, what we do with people. And it's a diagram, which is this, which is initially useful for the therapist. We don't give it to participants straight away, although if it feels appropriate, we give it to them later on. And that diagram is the kind of framework, and it's the basis of some visualization exercises that we do, which I'll talk you through. So you can see that it's this, there are the steps. There's the acceptance. There's the step one is when you dive down. So at the beginning of a psychedelic experience, often people are still in their minds a bit, they're thinking, they're anxious, and then it's this moment of surrender, of letting go, of saying yes to the experience and diving down. And then the second stage is about like imagining diving down to the seabed and imagining that process of diving down as an embodied dive. And at this point, they do a body scan from their fingers to their toes. And that helps them link into their emotions by seeing where there's tensions, feeling into any tight areas. Helps the body's a really amazing way to connect to emotion. So they dive down into their body, and then they look for the oyster shells. And the oyster shells are the things that are painful. And the idea here is that it's opening up the oyster to find the pearl rather than just trying to swim away from it. And then when they have the pearl and the oyster, or pearls, they then swim up. They swim, they have the pearl in their hand, and they swim to the surface. And then they burst through the surface of the water, and they can look around them, and there's this feeling of expansion and openness. And then at that point, they look at the pearl in their hand, and they think about what that means and how that can serve them, what that meaning can be used for in the psychedelic experience, if this is done as a preparation, a visualization, or just in life in general. So to show you in images this kind of journey, before I go into more detail about the visualization, I'll show you some pictures so that you can imagine you're doing this dive yourselves. So you're diving down, and the therapeutic support from the two guides is the oxygen tank. So it's not a directive therapy. The therapists aren't fixing the person. The therapists don't have any idea about what should fix that person. They don't have any idea what the content should be or what it is. They usually don't understand it when it's happening. You're observing a process and you witness it with respect. And you can be there as a reassuring presence. So you can be the oxygen to help them keep going. You can hold their hand. You can respond in whatever way you think is right in the moment. You can be there for what they need, but you can't direct it. And then it's diving down and looking around, and there might be some beautiful things, and often people see beautiful colors, but we really encourage people, go towards what's painful. So go towards what feels cold and hard and that you want to swim away from, go towards that. And then they get down to that seabed and they see some spiky oysters and they prise them open. And this is the opening process that psychedelics can really do. This is the resilience building, it's the opening up of the things that are difficult and saying yes to them. And so then finding the pearl and the oyster, if there is one, and then swimming up. Seeing the beauty of it, feeling the meaning, and then this state of connectedness and being linked to everything. So we have this diagram, and we use it to inform 2 visualization exercises. And all the scripts from this will be in a paper that's coming out quite soon, I think. It's the Journal of Contextual Behavioral Science. It's an acceptance and commitment therapy journal, and it's going to be a special issue on psychedelics. So this paper will be there, and there'll be scripts of all the visualization exercises, the diagrams, everything is there. So, although no doubt the model will evolve because it evolves all the time, but this is its current iteration. So the prep we do, I think probably the key part of the model, the thing that we find really works, is the preparation visualization. So there is a visualization exercise that essentially takes people through this journey, but as part of the exercise, they do it in the room, so they're lying on the couch, the music is playing lightly, they've got the headphones on, the eye shades on, and it's a real chance to practice what the psychedelic experience is going to be like. So you're going through the steps as if they're doing it the next day. And people really engage with emotions without any drug. When people do this visualization exercise of swimming down and going down to the oysters, they have very powerful experiences often, and they will tell you what the oysters are. So it's interactive, and that gives you a chance as a therapist to practice, because in the psychedelic experience, it can be quite hard to communicate, because it's not a usual therapeutic environment. They're lying on a bed, they've got the eye shades on. So it gives you this practice run of how you'll communicate with each other in that space. So we do this kind of run through, and they tell you what their oysters are. So you do the body scan with them as they dive down, and then you ask them to look for the oysters. They tell you what the oysters are, and then you go through this process of them looking for the meaning. And they find the meaning, they find the pearls. This is without psilocybin. And then they swim up, and then we use what they find as a pearl to inform their intentions for the session the next day. So we also have an integration visualization, and that's quite similar, but it's subtly different, and that's for them to do at home. We have an audio recording, and they use that to consolidate what they've learned in the experience. I don't really have time to go into too much more detail. The paper has all the detail that anyone might need. And I guess just the key thing to say is that it needs to be flexibly delivered. Delivered is not a good word. It needs to be flexibly embodied, because it really must be for each person an individual journey. Well, it is. So for each person, it will look very, very different. The ACE model is not in any way a standardized manual. It's a framework. And it's simple, and it's really good as a therapist to remember this kind of accept, connect, embody. Just even remembering those 3 terms, it can be very useful for formulation. So when I think back all the participants I've been a therapist for in all the psilocybin work, for each person I've got a kind of what was their accept, what was their connect, what was their embody. And it's a really nice shorthand for just remembering the key points. The paper that's coming out is going to be talking about the links between the diagram and also psychological flexibility. No time to go into it now. The paper will go into it. But basically, I developed the diagram based on the 6 Hexaflex processes from acceptance and commitment therapy. And then just very final thoughts, just to remember that the benefits that we are seeing in our study are not permanent. We hope that we're planting a seed of a new way of being, and we hope that we can expand the window of flourishing afterwards. But we think that we will need follow-up sessions, because for somebody like John, he's now back in his bedroom, and his psilocybin experience is a memory, and a painful memory of what it could have been like, and it's not like anymore. So we must keep that in mind. And that it doesn't work for everyone. We find in our study that some people have high-dose psilocybin, and it doesn't. Either they don't really feel it, or there are no benefits. And we're starting to develop theories about why that might be, but that's also important to remember too. And we think maybe if there's more time for trust building and more sessions, we're very confident we can come up with a model that is really effective for many people. Thank you.
Wow. Maybe could you say more about, and by the way, great formulation. I love the ACE framework. Could you say more about when you alluded to those cases where it doesn't go right?
Yeah.
I mean, we deal with this in terms of like, we don't introduce the mystical experience, but they're like, they read about it and they didn't get that. And it's like, I wonder, if you give them this model of diving down and they're convinced, I had nothing like that. How do you deal with that? Do you try to, kind of post hoc say, well, weren't there aspects like that? Or maybe could there be a risk in being too explicit beforehand about what it's going to be like? Or clearly you've deeply thought about this. How do you deal with those tough cases?
Yeah, I'd love to talk in so much more detail about this whole issue, but basically we don't introduce it as a model until after their first session. So they'll have a preparation visualization, which is that model. It's asking them to dive down into the water, and they're on a boat, and then they swim, and then they dive down, and they look for oysters. But we don't introduce the model in any formal context at all. And for lots of people, we never introduce it as a formal framework. It's just for us to help guide us, and it guides the visualizations. For some people, we do go into a bit more detail if they're a bit more interested in that kind of thing. At the end of the study, we might send them the diagram. But it's more about guiding it. I mean, it's a very good point about expectations. This is a key thing we're seeing now in the study. People come through. The first study, there was not very much out there about psychedelic sessions to psychedelic treatment. So I think people came in just seeing what it was going to be like. And now people come in expecting either a brain reset or a mystical experience. And in a way, I suppose what this model is doing is it's kind of going away from those nice ideas of a mystical experience and a brain reset into, okay, but actually we're going to do a lot of really hard work here. Because it sets up that idea that this is, we want to go towards the pain, and it's not, it's... And if people do have a mystical experience, and if people have something that's really, then they're happy, it tends to kind of guide itself in a way, so, yeah.
Thank you. I would like to ask you if you believe that, considering that depression may be connected usually to trauma, and in a lot of occasions, especially major depressive disorder, I would like to ask you if you believe that the accept, connect, embody model would work also with depression linked with social-based traumas, such as cultural-based trauma, racial-based trauma, gender-based trauma, because acceptance in these type of situations can be something really specific and hard. So what do you think about it?
Absolutely. I hope so. I really do, because I don't think it's about the particular DSM category, like whether it's depression or, I think underneath it, disconnection underlies so many of these things that I think we're at a point as well that we know that we need to start addressing these things. And so I think there is a paradigm shift towards acceptance and connection. I feel it. So I think that however that plays out, that we will start to see this kind of approach being used, not necessarily this model, but this kind of approach being used more. The idea of reconciliation, coming together, I suppose with the challenges that we face as a species, there is a need now for us to heal the separations, really.